What is the best way for me to prevent my child getting a urinary tract infection? My name is Professor Caroline Fertelman, also known as Dr. Carly, and I've over 30 years of experience of working as a paediatrician in the NHS, and I'm also the mother of 3 now adult children. This is a question I get quite often asked. How do I prevent my child from getting a urinary tract infection? For me, there's a number of issues. It also depends if they're a boy or a girl. But for both sexes, it's really important to treat and also, if possible, prevent constipation. So you want your child to be passing regular, medium softness stools, however often they pass. It could be once a day, it could be 2 times or 3 times a day, or it could be once every few days. It doesn't matter, as whatever's regular for your child. And if you're not sure what stool should look like, look up the Bristol stool chart, and that has pictures of all the different sorts of stools. 1 is very hard like a log, and 7 is very loose like diarrhea, and you want your child to be somewhere in the middle, normal stools. And this is probably the best way to prevent urinary tract infections. The reason that constipation causes them, or is more likely for your child to get them, is because your child's not able to empty their bladder more easily, and also they're not maybe necessarily so able to recognise the signs in their bladder. So I think it's really important that if your child has constipation, that's the first thing you should be doing to prevent a urinary tract infection. I'll be calling them UTIs from now on. I don't usually like 3-letter abbreviations, but in this case I shall use UTI. The other issues are that sometimes children don't always empty their bladders fully. So I think if you feel that your child is sort of leaves a little bit and then comes back and dribbles a bit later, is when they go to the toilet, make sure they almost what we call double void. So they pass their urine, they do their pee, and then you say, right, is anything more? Could you maybe have a little bit more of a try so that the bladder is fully empty? That's one way to also help things. The other main issue is urinary tract infections that we see particularly in toilet-trained little girls. And that's because obviously where they do their poos is very close to where they do their wees, and most urine infections are actually the poo bugs that have climbed back inside. So it's very important when your child's little that you wipe her, and it's always from front to back, from the moment she's born until she's able to do it herself. So it's always from front to back, whether it's whether they've opened their bowels or they've passed urine. And I think it's also really important for you to know that it's really difficult for little girls to be able to do it. They don't have the ability to wipe themselves properly, probably till the age of 7. Of course, this does make it difficult because when they go to school at 5, 6 or 7, school teachers aren't going to wipe them. But mostly for after a wee, they can just drip dry. Boys obviously not a problem at all, and once they're able, it's always good for you to wipe their bottoms when they've done a poo-poo, and often most children that I know will always open their bowels at home, so usually it's not a big problem. So these are my top tips to prevent urinary tract infections: constipation, make sure you empty your bladder properly, and if it's a girl, that you wipe her after she's been to the toilet, especially when she's opened her bowels, until she's really able to do it from front to back. It's quite complicated, so I'm sure you'll be able to do that. If you like this and any other videos, please follow me on my soon to be launched Dr. Carly's channel on YouTube.